We're going to hear now from Susan Fila at Jewish Family Services of Los Angeles. Susan, can you tell us a little bit about your PDSA?
Sure, Angela. So our initial plan was we wanted to ensure that we had a strong partnership, not only with the hospital leads, but most importantly with all of the social workers, nurses, and discharge planners that refer their patients to us. And we already had a pretty strong partnership, but again, you heard before, due to turnover, staff turnover, and some issues happening with some of the hospitals, we wanted to re-engage them. And so how did we do this? Well, we did it in 2 different PDSAs. We started by hosting a luncheon in 2 of 3 of our partner hospitals, and we invited the key social workers, the nurses, discharge planners, and we also had some physicians present. We also had our CCTP coaches and supervisors there as well. We introduced CCTP and explained the goal of the program and the objectives. And the luncheon was held at the hospital and included medical staff and CCTP staff. So we gave a presentation, we provided food. A lot of the social workers in the hospital, we had realized, didn't really know much about CCTP because there were so many players involved. So what were our results? Well, we immediately found an increase in the number of CCTP referrals at those 2 partner hospitals. But more importantly, there was more dialogue between the CCTP coaches and the hospital staff. So one of the things they asked for was the CCTP coach cell phone numbers. And so we provided that to the hospital staff so that they could reach them during the day when they were having patient issues. We also listened to what some of the hospital asks were that came out of this luncheon, and one was they had asked for us to really provide them with a full-time coach presence. And because that was a challenge, what we decided to do moving forward was to take, as an initial phase, one of our coaches and split her in all 3 hospitals. And we're moving even further along now where it's working so well, we're actually going to add on another coach. And so this coach actually engages all the patients, engages the hospital, so she has multiple roles. We've also recently, another PDSA that came out of this was we revamped our readmission reviews to meet the needs of the hospitals.
Susan, it sounds like you did a great deal with that PDSA, and I loved hearing the idea of just refreshing the connections with in light of the staff changes. It seems to really resonate with some of the things that we heard in the last presentation as well. Thank you so much for sharing today.